Obesity. Obesity has become increasingly common in the United States due to a mix of unhealthy lifestyle habits, like frequently eating high-calorie fast food, drinking sugary beverages in excess, and spending long hours sitting or on digital devices with little physical activity. This condition develops when the body stores too much fat, especially around the abdomen, disrupting normal metabolic balance. In the US, about 41.9% of adults are classified as obese. Common symptoms include getting tired easily, shortness of breath even during light activity, and an overall feeling of heaviness or discomfort in the body. Treatment typically involves healthy dietary changes and structured weight loss programs that include regular physical activity. There's also a growing concern among younger populations. About 1 in 5 children and teens, ages 2 to 19 in the US, are living with obesity. Stroke. Stroke is very common among older adults in the United States. It's often linked to the natural aging of the body, along with additional risk factors such as high blood pressure, diabetes, high cholesterol, and unhealthy lifestyle habits. A stroke occurs when blood flow to the brain is interrupted, either by a blockage in a blood vessel or by a blood vessel bursting. Without enough oxygen, brain cells begin to die rapidly. Common warning signs include facial drooping on one side, numbness or weakness in an arm or leg, difficulty speaking, and sudden blurry vision. A startling fact: someone in the US dies from a stroke every 3 minutes and 14 seconds. Treatment usually involves blood-thinning medications, physical therapy, and medical rehabilitation to help restore lost bodily functions. Depression. High levels of stress from work and daily life have led many people in the United States to struggle with depression. The condition occurs when chemical imbalances in the brain affect a person's mood, thoughts, and ability to carry out everyday activities. About 18.5% of US adults have been diagnosed with depression at some point in their lives, and that number has continued to rise over the past decade. Common symptoms include persistent sadness, loss of interest in activities once enjoyed, sleep disturbances, and overwhelming fatigue. Treatment often involves psychological therapy, support from mental health professionals, and ongoing emotional management. Cancer. Cancer is widespread in the United States, largely due to delayed diagnoses and uneven access to healthcare. The disease develops when abnormal cells grow uncontrollably, invade nearby healthy tissues, and eventually spread to other organs. Early warning signs can include persistent fatigue, unexplained weight loss, unusual lumps, or changes in how certain parts of the body function. There are many types of cancer, but some of the most common in the US include breast cancer, lung cancer, prostate cancer, colorectal cancer, skin cancer, melanoma, pancreatic cancer, and liver cancer. According to the American Cancer Society, an estimated 618,120 cancer deaths are expected in the United States in 2025. Treatment options typically include chemotherapy, radiation therapy, surgery, and targeted therapies, depending on the type and stage of the cancer. Arthritis. Arthritis is considered a chronic condition that develops gradually over time. It occurs when the joints become inflamed due to cartilage breakdown, or when the immune system mistakenly attacks joint tissues, leading to pain, stiffness, and limited mobility. In the United States, certain regions have higher rates of arthritis. West Virginia, for example, has one of the highest, with about 33.6% of its population living with the condition. Major risk factors include older age, excess body weight, lack of physical activity, and diets high in sugar and unhealthy fats. Common symptoms include persistent joint pain, morning stiffness, and difficulty moving the affected joints. There are more than 100 different types of arthritis, with osteoarthritis being the most common form. Constipation. Constipation often develops from eating too many processed, low-fiber foods, like fast food, white bread, excessive cheese, and processed meats. It happens when the movement of the intestines slows down, causing the colon to absorb too much water from the stool. As a result, the stool becomes hard, dry, and difficult to pass. Common signs include having fewer than 3 bowel movements a week, hard or dry stools, and pain or straining during bowel movements. In the US, about 16% of adults are reported to experience chronic constipation. The risk is higher for people who don't drink enough water, rarely exercise, are older, or take certain medications. Treatment typically involves increasing fiber and fluid intake, staying active, and using mild laxatives if recommended by a healthcare provider. Type 2 diabetes. Type 2 diabetes often develops from dietary habits high in added sugars, refined carbohydrates, and saturated fats. In the United States, more than 38 million people are living with diabetes, and the majority of them have type 2. This condition occurs when the body becomes resistant to insulin or can't use it effectively, causing blood sugar levels to remain elevated even though insulin is still being produced. Common symptoms include frequent thirst, increased urination, fatigue, and blurry vision. Risk increases for people who are obese, rarely exercise, have a family history of diabetes, or are over the age of 40. Treatment typically focuses on healthy eating to manage weight and keep blood sugar levels stable. Type 2. Diabetes also raises the risk of serious complications, including heart disease, kidney damage, and nerve damage. End-stage heart failure. The mortality rate for end-stage heart failure reaches 50 to 60% within just 1 year. This condition occurs when the heart muscle can no longer pump blood effectively. At this stage, the damage to the heart is severe and permanent, making it unable to meet the body's need for oxygen and nutrients. Common causes include long-term heart disease such as repeated heart attacks, uncontrolled high blood pressure, or chronic valve disorders. Symptoms often include shortness of breath even at rest, swelling in the legs, and fluid buildup in the lungs and abdomen. Modern therapy offers options such as mechanical heart pump devices and heart transplantation, both of which can significantly improve life expectancy and overall quality of life. Tooth decay. Many people think tooth decay is a minor issue, but it can actually develop into serious infections, dental abscesses, and damage to surrounding tissues. The condition occurs when bacteria in the mouth produce acids that erode the enamel, usually due to leftover food particles and excess sugar buildup. Common symptoms include tooth pain, sensitivity to hot or cold foods, small visible holes in the teeth, and persistent bad breath. In the United States, nearly 90% of adults ages 20 to 64 have experienced some form of tooth decay. The main causes include poor oral hygiene, high sugar consumption, and irregular brushing habits. Influenza. During the 2023 to 2024 flu season, an estimated 40 million flu cases occurred in the United States, showing that influenza can be far more dangerous than the common cold many people assume it to be. Influenza develops when the flu virus infects the respiratory tract and weakens the body's immune defenses. It spreads mainly through droplets released when an infected person coughs or sneezes, and it can also spread more easily when someone with a weakened immune system consumes foods prepared in poor hygienic conditions. Symptoms include high fever, dry cough, sore throat, muscle aches, headaches, and extreme fatigue. In addition to getting vaccinated, preventive steps like frequent hand washing, wearing masks, and avoiding close contact with sick individuals can help reduce the spread of influenza.